Good afternoon, everyone. Today I will be presenting the results of GD's FEES and video fluoroscopic exam. A FEES exam was conducted to evaluate GD's anatomical regions involved in swallowing function, specifically the larynx. During the FEES, I assessed GD's oral preparation of the bolus and spillage of parts of the bolus into the pharynx prior to the swallow. At the onset of the swallow, I assessed GD's airway closure, tongue propulsion, tongue base retraction, velopharyngeal closure, hyoid elevation, laryngeal elevation, epiglottic inversion, and pharyngeal contraction. After the swallow, I assessed GD's tongue relaxation, velopharyngeal port reopening, airway reopening, hyoid larynx descent, epiglottis returning to rest, and relaxation of pharyngeal walls. A video fluoroscopic exam was also conducted to evaluate the type and status of dysphagia present. During the video fluoroscopic exam, I evaluated GD's bolus transit time, motility problems, and amount and etiology of aspiration if present. I evaluated GD's chewing and oral movement during the oral stage. I evaluated GD's onset of a pharyngeal swallow. I evaluated GD's motor components of a pharyngeal swallow, movement of hyoid larynx, tongue base, pharyngeal wall, and cricopharyngeal region. Results of these instrumental evaluations concluded that GD presents with moderate severe oral phase dysphagia, characterized by reduced oral strength, coordination, sensation, poor tongue movement, mastication inefficiency, and impaired oral pharyngeal transport. After the instrumental evaluations were completed, I felt it was appropriate to move forward with PO trials. Trials started with thin liquids, a single cup using water. I asked GD to hold the bolus in her mouth until asked to swallow. 3 to 4 ounces of thin liquid was the optimal amount. Self-administration was optional. Once the bolus hold was achieved, I asked GD to swallow. Result: GD presented with a wet and gurgly voice as well as a consistent throat clearing. The next PO trial was thickened liquids with a single cup. I asked GD to hold the bolus in her mouth until asked to swallow. 3 to 4 ounces of thickened liquid was the optimal amount. Self-administration was optional. Once the bolus hold was achieved, I asked GD to swallow. Result: GD presented with throat clearing post-swallow. Next PO trial was nectar thick liquid with a single cup. I asked GD to hold the bolus in her mouth until asked to swallow. Again, 3 to 4 ounces of the nectar thick liquid was the optimal amount. Self-administration was optional. Once the bolus hold was achieved, I asked GD to swallow. Result: GD presented with no abnormal swallowing functions and stated that she felt no changes post-swallow. Next PO trial was pureed foods with a spoon. I administered the bolus to GD and then asked GD to hold the bolus in her mouth until asked to swallow. Once the bolus hold was achieved, I asked GD to swallow. Result: GD presented with no abnormal swallowing functions and stated that she felt no changes post-swallow. The results of these PO trials: GD was placed on a level 1 diet due to her swallowing deficits, such as insufficient lip closure, poor weak mastication, and poor weak oral strength.
Hi, Gail. How are you doing today?
I'm okay. How are you?
I'm good. I'm just here to speak with you and your family about your diagnosis and how we will proceed from this point.
Okay.
Based on your labs, we see a stroke that has occurred on the left side of your brain.
Oh no. Horrible.
I had you complete some different swallowing trials since you stated that you have difficulty with eating and drinking since your stroke has occurred.
Yes, I've had so much difficulty with that.
Okay, so when you were presented with water, it was noted that you had a sort of gurgly voice following the swallow.
Okay.
Then with the thickened liquids, you cleared your throat fully after the swallow. I saw the safest swallow when we were using pureed foods. During this trial, you said that you felt no changes after the swallow.
Right.
And based on examining you at your bedside and then viewing your swallow using both a fiber optic endoscopic evaluation and a video fluoroscopic exam, I was able to observe and record your swallowing ability.
Oh, okay. So what did you find?
So based on all of these findings, it was concluded that you have what is called moderate to severe oral phase dysphagia. This dysphagia is characterized by reduced strength, coordination, and sensation, as well as poor tongue movement and poor chewing. You also show difficulty with carrying the food from your mouth down to the back of your throat. All of these cause a risk for malnutrition, weight loss, dehydration, and there's even a risk for aspiration pneumonia, which is when the food or the liquid enters your airway and can cause bacteria to grow.
Oh, wow. So why is it that I'm only allowed to have pureed foods then?
So that's a good question. Based on our results of the swallowing trials, we found that pureed foods allow you to gain the nutrition, but also have the safest swallow because you have control during that phase, and it does not put you at a risk for any other complications.
Okay, I understand. Thank you so much for your help.
Of course, I look forward to speaking with you again and beginning treatment with you.
Hi, Gail. How are you doing today?
I'm okay, thank you. How are you?
I'm doing good, thank you. Are you ready to get into our swallowing exercise for today?
Yes, I am. I'm excited.
Okay, great. So today we will be practicing an effortful swallow. So this technique will help with some of the weaknesses you're feeling in your mouth.
Okay,
Okay?
got it.
So to get started, first, I want you to sit comfortably. Okay. Now I want you to squeeze your throat muscles as hard as you can and then swallow.
What do you mean? What do you mean? Like,
Right. So I want you to imagine that you have a grape-sized piece of food stuck at the back of your throat and try to swallow it.
okay,
Okay?
I'll go.
Okay, great. So now I want you to do that 5 times.
Okay. Again. Okay, that was 5.
Okay, great. And how did that feel?
It definitely was hard at first, but it can help because it
Right.
makes me more aware of really making sure I'm swallowing properly.
Exactly. And we're going to continue to work on that, okay?
Okay.
Great job with the effortful swallow.
Thank you.
Okay, Gail. So the next technique we're going to use is the Mendelssohn maneuver.
Oh, what does that do?
This is a compensatory strategy to increase the esophagus opening, and it's so you can have an easier flow of your food while you're swallowing.
Okay.
Okay? So what I want you to do, again, is just sit comfortably,
Okay.
and I want you to start to swallow normally. Now, when you feel your Adam's apple at its highest point, squeeze your throat muscles again to hold it in that position for 3 counts and then relax. And you can actually use your fingers to help you hold your Adam's apple at its highest point. Okay? And I want you to repeat that 5 times.
Okay. And I hold it for 3 seconds, for 3 counts?
Yes, 3 counts.
Okay, that was 1. Was that right?
Good, yes.
Okay.
Good job.
Okay, that's 3. Okay. 4. Okay, 5.
Great job, Gail. How did that feel?
That felt good. It was
Okay,
tough at first for me to be able to feel when like it was at its highest point, but once I could feel that and I squeezed it, it definitely helped.
right. Okay, great. Excellent. So we're going to continue to work on that one as well. Okay?
Okay, thank you.
You're welcome.
Hi, Gail. Today we're going to work on some jaw exercises.
Okay, sounds good.
So these exercises will help you chew your food safely.
Okay, got it.
So let's start with what's called a sideways jaw stretch. You're going to move your jaw from one side to the other as far as you can, like this.
Okay. Ow, that kind of hurts.
All right, so you shouldn't be feeling any pain for this. You should just be feeling the stretching of the muscles.
Okay.
All right. So once you do that, do 5 times back and forth. Good? And tell me when you're done.
Done.
Good. Our next one is an open jaw stretch. So for this, you're going to make believe like you're about to bite into a gigantic apple. Good. For this, I don't want you to cramp up, but I want you to feel the stretch in the muscles. So you're going to do this 5 times. And when you keep your mouth open, you're going to hold it for 5 seconds each time.
Okay.
Good job.
2 more. Oh yeah, I do feel the stretching.
Good. Yeah, we're just working on all those muscles that help us chew.
Okay, done.
Good job. Alrighty, hi Gail.
Hi.
So we're gonna work on another exercise. So for this, it's called the head tilt technique. So what I want you to do for me is you're gonna move your head to your right side. You're gonna tilt your head to the left. And then I want you to give an effortful swallow.
Like this?
Yeah? Look up. Give me a nice good swallow. Tighten all those muscles. Good. So now, did you bring any pureed foods with you like we discussed?
I brought
Awesome.
yogurt.
Oh, delicious. All right, so let's take not so much on our spoon. That's a little bit too much. Let's do a little less than half of that. Because we want to focus on controlling all of the food in the mouth with our muscles right now. So we want to be aware of everything we put in. Very good.
Okay.
So what you're going to do, let's remember. So you're going to tilt your head to the right. Good. Twist up to the left. Go ahead and go right ahead with the spoon. Make sure you're closing those lips nice and tight. And push the food to the back of your throat with all those tight muscles and give it a good swallow. Good.
Like that?
Yep, so this ensures a safe swallow when we're eating, okay?
Okay.
All right, let me see one more time. Good amount on the spoon
Tilt to
this
the
time.
right.
And tilt up to the left.
Just up to the left. Okay.
Good. Tighten those muscles, close those lips, and a nice good swallow. How does that feel?
That felt much easier. That definitely helps. I like that one.
Awesome. Good job.
Thank you.